Do you suffer from headaches? Do you find yourself going in circles trying to find a cure? It might be your teeth causing you trouble. And joining me today from Stoneridge Dental Care is Cynthia Levy and patient Nancy Castle. Good to see both of you. And Cynthia, let me start with you. What do teeth have to do with headaches?
A lot.
More than we probably ever thought or
Much
imagined.
more. It's actually estimated that 80 to 80% of all headaches are actually bite-related.
Wow.
And unfortunately, most people, when they have a headache, they go to the doctor. And what do? We treat with medications. So we're masking symptoms. We're giving medications to try and cover up the pain and help patients and ease the pain, when the reality of it is a large majority of these are actually related to the way your teeth come together.
Are we talking just little gnawing, headaches every now and then, or really bad migraines?
We're talking debilitating headaches. We have patients that come into Stoneridge who have not been out of bed in a week, who have a migraine every 3 or 4 days. This is a sort of headache that can, affect your life, obviously. How do you keep a job? How do you take care of your children when you are, in bed half the time?
Well, Nancy, is this what happened to you? Did you have headaches that all of a sudden you couldn't figure out what's going on?
Well, my headaches were not that severe, but they were constant. And I had also jaw pain, and I suspected it was TMJ.
And TMJ is what, Cynthia?
TMJ is it's a malfunction or dysfunction in the joint that you think of. It's right here. It's the temporomandibular joint. And sometimes you'll hear popping and clicking and pain and tightness and stress here in this area. And that's generally a TMJ syndrome.
And most people would associate that jaw pain with TMJ.
Yes, you would.
But they wouldn't necessarily associate
Correct.
headaches with TMJ.
Correct. But it's all very related. Neck pain, pain between your other eyes, pain up here, that's what patients generally come in with. General, sometimes even as Nancy had down her right arm.
Oh,
she had
gosh,
no
really?
idea.
So what happened? What kind of treatment did you get, Nancy?
Dr. Levy did a TENS treatment, which is relaxes the muscles, and made me a mouth guard that fits on the lower part of my jaw. That in the beginning I wore 23 hours a day for quite a while, and I felt better and better, and eventually now I just wear that mouth guard at night, and I feel really great.
It is amazing what a little piece of plastic can do.
It is amazing.
Yeah.
It really is.
How does it work?
It works because what he's doing is trying to find the place where the muscles are happy. Because there's a constant war going on between teeth and joints and muscles. When you relax the muscles, when you allow her to find the place, that bite, where she's most comfortable and she's not having stress and tension, the pain goes away. And so you literally find that bite. He makes a special mouthpiece that you wear, and we hear stories like this over and over again.
Does the bite actually change?
It does change your bite, yes. You're actually generally opening the bite. And some people will go on then and have it sort of permanently taken care of. Nancy can handle just wearing it at night. Some people also have aesthetic issues because their teeth have been worn down and ground down from all these years of pain and from clenching and all that. So you actually will restore the bite with porcelain to that new bite. And so you end up with no headaches, no more TMJ problems, and a beautiful smile.
So how do you feel now, Nancy?
I feel great. I really do.
Are you amazed at it, actually, when you think of what you were feeling to how you feel now, and then just finding the right cure? What a difference.
Yes. I wish I would have done it sooner.
I'm sure.
I really do. But I feel great, and there are days still where I can feel the headache coming back or the symptoms, and I'll wear that mouth guard through the day, and it really helps.
Can any dentist do this, Cynthia?
No. It does require special training. Dr. Levy is a neuromuscular dentist, and they learn how to look at dentistry from a neuromuscular viewpoint, and it does require extensive training.
So if someone at home is feeling these headaches or what Nancy described, and they want a dentist, they really should look for someone like you guys who really specializes.
Yes, they should look for someone.
Everybody does.
Yeah, someone who's had extensive training, who is a neuromuscular dentist, and who does this sort of procedure.
Great. Nancy, we're glad you're feeling better.
Thank you.
And Cynthia, thanks for being with me again.
Thank you.